pretty darn close to quorum and over it, in fact. So I'm going to go ahead and call our ADDPC full council meeting to order at 10:04 a.m. Good morning, everybody, and thank you so much for joining us today. Marcy, would you like to do roll call?
Sure, I will be glad to. Good morning. I'm just going to go down the list here of folks that I have marked. Melissa, I'll start with you.
Yep. Good morning, Council Chair.
Thank you. Monica.
Here, self-advocate, start that again, self-advocate and chair of the grants committee.
Thank you, Monica. Megan Cox.
Megan Cox, a family member and advocate.
Thank you, Megan. Ken.
Good morning, everyone. This is Kim Cows and council member.
Okay. Eric Jensen. Is he on mute? Did we lose Eric?
Yes, I was on mute. Thank you. This is Eric Jensen, community member and advocate.
Thank you, Eric. Good morning to you. Kathy.
Good morning. Kathy Lewandowski, family member, chair of the work plan committee.
Thank you, Kathy. Christina Lopez.
Good morning, everybody. Grants member, council member, and self-advocate.
Kristen Mackey. Kristen.
Hi there, Kristen Mackey, the administrator for Arizona Rehabilitation Services.
Thank you. Gabriella.
Gabby Orozco, council member.
Thank you. Vijay.
Good morning, Vijay. Sorry, parent and family member.
Thank you, Vijay. Sophie.
Good morning, President, and food commanders for everyone.
Terrific. Let me see here. We have Ben. I think I saw Ben join in.
Present. Ben Kaufman, Access Representative.
Okay, thank you. Mary.
I'm Mary Slaughter. I'm a board member representing a person with IDD who was institutionalized and navigations committee.
Thank you, Mary. Mateo.
Hi, I'm Mateo Sweetop. I'm a self-advocate.
Thank you, Mateo. Are there any other council members that I missed?
Nope.
Thank you. Go ahead. I don't hear any other council members. Okay, let me move on. Before we do staff, let me jump to guests. We have a number, so bear with me. I was trying to write that name. Holly.
Good morning, everyone. This is Holly Hewlin from the Institute for Human Development, and I am here. I'm kind of representing IHD and Kelly Roberts.
Thank you. Taylor Porter.
Good morning, everyone. My name is Taylor. I work with DES. I'm their legislative liaison.
Thank you. CJ, if you can help me help your last name, is it Lucelle?
CJ Loisel, yeah. Good morning, everyone. CJ Loisel from Access.
Thank you, CJ. Brianna Farmer.
Good morning, everyone. Brianna Farmer, legislative liaison for the Department of Economic Security.
Thank you. JC.
Hi, JC Farkas. I will be replacing Wendy Perrin-Johnson, who's no longer with the Sonoran Center, as a representative from the Sonoran ESED.
Thank you, JC. Scrolling down here. Any other guests that I've missed? Did not do introductions for.
I thought somebody else just joined us. Maybe I'm mistaken. Okay, I might be wrong. If you're new and Marcy didn't call you, please speak up. Might be my mistake. Thank you.
Okay. All right, staff. So, John.
I am here. John Myers, Executive Director.
Lonnie.
Lonnie St. Cyr, Fiscal Manager.
Michael,
Michael Leva, Contract and Grants Coordinator.
Jason,
Jason Sneed, let's see, Research and Communication Specialist.
thank you, and Steve.
Good morning, Steve Freeman, Director of Communications.
Thank you. Okay, anyone else that I did not get a chance to call and introduce? Is there Nikki?
That's who I thought I saw join.
I saw, yeah, I wrote down a Nikki and then I didn't get the last name. Okay. Back to you, Melissa.
Okay. Thank you, Marcy. Thank you for that. And thank you, everybody, for making it this morning. We're going to move on to agenda item B, our minutes from our June 23rd, 2023 full council meeting. Has everybody had a chance to review the minutes? And if you have not, or if you have, I hope you have, are there any comments or questions or corrections that need to be made to the draft minutes? Okay, hearing none, I'm going to call for a motion to approve the full council minutes from our June 23rd, 2023 meeting. Do I have a motion?
I move, this is Kathy, I move to approve the full council minute.
Thank you, Kathy. Do I have a second?
Aye.
I'll second.
Is that Monica?
Yes.
Thank you, Monica. All those in favor of approval, please say aye.
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 All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion carries. Agenda item C, our fiscal contract update with Lonnie.
Give me a second.
Sure. And while you're bringing that up, if you're a little newer to the council, when we're calling for a motion, anybody can make that motion. Anybody can second. So I strongly encourage your participation. So you're more than welcome to speak up.
Okay, hopefully you guys can see the ADDPC financial update.
Yes.
Thanks, Melissa. The council has fully obligated the fiscal year 2021 award in the amount of $1,535,342 and has met the original September 2022 obligation deadline. However, ACL has granted a one-year no-cost extension for fiscal year 2021 funds. This extension made the new obligation and project period through September 30th, 2023, allowing for an additional year for the work to be completed. The council has until December 31st of this year to liquidate fiscal year 21 funds. There is approximately $3,731 remaining to be liquidated. And we're working with the Sonoran USAID to get that final billing in. The council has received the full allotment for fiscal year 2022 in the amount of $1,500,930, which is what was previously estimated. This is level funding with fiscal year 2021, excluding the Puerto Rico reallotment of $34,412. The obligation and project periods were through September 30th of this year, with the liquidation of funds through September 30th of 2024. However, the staff submitted a letter to ACL asking for a no-cost extension for the project period. And so now that project period is September 30th of next year. We just received the notice of award for this extension this week. The council has fully obligated these funds and will need to complete the work by next September. There's approximately $234,756 remaining to be liquidated of these funds. And finally, the council has received the third allotment for fiscal year 2023, funding in the amount of $398. It was just a minor adjustment. This brings the current fiscal year 2023 total amount to $1,501,328. There's approximately 395,568 remaining to obligate, which we would like to do before the end of the month so the work can be completed in the second year of funding to meet the period of performance requirement, which runs through September of next year, with the liquidation of funds through September of 2025. Any questions on this sheet? Okay, moving on to the next one. These are the additional ADDPC award funds that we got as part of the COVID funding. The council has received an additional award in the amount of $84,288 for COVID-19 specific projects. These funds are being tracked and reported on separately. ACL has also granted a one-year no-cost extension for the use of these funds, and we have until the end of this month to fully spend and complete the projects for this. To date, we have spent $59,592 and have encumbered $23,770 through September of this year. The award was granted to NAU IHD for a project to better understand the lived experiences of people with disabilities throughout the pandemic, including barriers to health services, such as awareness and access to the COVID-19 vaccine. The second set of funding that we received was to expand the public health workforce within the disability network. The amount for that funding is $95,319. The funds will also be tracked and reported on separately. The obligation and project period are through September of next year. The contract for this project has been awarded and the funds are now encumbered. Any questions on this sheet? Okay, moving on to the next one. Sorry, it's a little bit small. These are all of our current projects. There has been one 3-month no-cost extension granted to the Sonoran USAID for the refugee research project, which will now run through December of this year. Staff requested a no-cost extension from ACL to help facilitate this. Any questions on this sheet? It also reflects all of the projects that were voted on during the last full council meeting. The final sheet I'd like to share with you is the Arizona Developmental Disabilities Planning Council budget recommendation. This sheet reflects the projects outlined in the fiscal year 2024 work plan, as well as the funding that has already been approved in prior years. It shows a small shortfall of $19,272. Which will no longer be the case once the art project is removed from this sheet. It's highlighted in yellow. The rest of the project, it's highlighted in red. The rest of the projects to be discussed on the agenda today are highlighted in yellow and have been budgeted for. I also want to highlight the program administrative lines in each of the goal areas. This is where staff charges their time for state plan projects. This will make a little bit more sense when we talk about the administrative budget as another agenda line item. Any questions on this sheet? Okay, that's it for me.
Thank you, Lonnie. Appreciate that. And we have a lot to talk about grants-wise today. Okay, agenda item D, our executive director report with John.
All right. Good morning, everyone. Thank you very much, Melissa. Thank you very much, Lonnie, for the report. I would point out, because often those things are very small on the screen in front of you, that those documents were all included in the items that are posted on the council's website for today's meeting. So if you want to see one in a size that you can actually read, feel free to visit the website and download the documents. A couple of things to talk with you about. First of all, touching back on the COVID-19 public health workforce development money that Lonnie mentioned in her report. That project is underway. It did take us quite a long time to get things going, but we finally were able to work through the nuances of the contracting process with the University of Arizona and Sonoran USAID, which is serving as our fiscal agent on this project, the Regional Center for Border Health in Yuma, and the Western Arizona Health Education Center, which is part of the regional center, are the leads on this project. To date, they have conducted 6 different focus groups and are working with their partners around the state to conduct additional focus groups. The emphasis of this project is a study on the elder or aging IDD community and how the public health workforce and the public health system currently serve aging adults with IDD and will need to adapt their systems to serve aging adults with IDD over the years to come. Again, as we've mentioned so many times, we know that the IDD population as a whole is aging. People are living longer than they ever have before, but the systems that support them have not necessarily evolved to meet the growing needs of that aging population. So this project is focused on that. We are expecting to see results early in the new calendar year. The folks in Yuma are running the program through December 31st, and then they will provide us a report and some recommendations. From those recommendations and that report, the System Access and Navigation Committee of ADDPC will refine those recommendations and put together some policy proposals for moving forward. We'll continue to report on this as time goes on. Regarding the federal fiscal year 2024 and 2025 work plan submissions, those were due on August 15th. They were submitted. We did get a couple of very, very small requests for clarification. Really, it was nothing big. It was just a couple of things that needed to be reworded or kind of reflected differently on the report. But we submitted those clarifications, and our work plans for 2024 and 2025 have been approved. So we are moving forward with those. A couple of legislative issues, some bills that we have talked about in the past, but haven't had a chance to talk about kind of in their final form. A couple of things that came out of the legislative session in 2023, the first being Senate Bill 1291. This is the bill that was originally a guardianship and conservatorship bill, and then through various different machinations became a bill that was both about guardianship and conservatorship and about supported decision-making. As we mentioned in June, that bill was signed, it passed the legislature, it was signed by the governor in late June. So supported decision-making is will be, as of January 1st anyway, the law of the land in Arizona. There was a signing ceremony at the governor's office on September 5th, and Sophie and Jason and Melissa and I had an opportunity to take part in that signing ceremony, along with some representatives from ACDL, some representatives from the ARC of Arizona, and a variety of other organizations from around Arizona who contributed to the work on supported decision-making over the last 5 or 6 years. It was, I would say it was a high point, I guess, of the year for many of us, especially those of us who've been working on supported decision-making since it first became an issue in Arizona. So we will have we'll have photos. We've posted photos on social media. We'll have photos and more information in our upcoming newsletter for October. But it was a great day for us, and it was a great outcome on that particular bill. Senate Bill 1710 is another one we touched on briefly, I think, at our last meeting. This is a bill that relates to the Arizona State Hospital and the recommendation to move oversight of ASH from the Department of Health Services to an independent oversight governing body. That bill was controversial in our minds because it would have expanded the bed capacity at ASH and potentially would have meant that more individuals with IDD were placed in a situation where the staff and the programs were simply not designed to serve them. Even the leadership at ASH will admit that it is not a place where people with IDD can be appropriately treated. So we worked with a number of other advocacy organizations on this particular issue. Ultimately, there were some really dramatic and drastic changes to the legislation, and what passed the legislature and was signed by the governor was something that in no way negatively affected the IDD community. So we were pleased with that outcome, but I think the most telling part of this is that some really serious conversations have resulted from that whole process to try and make some changes at ASH to improve the conditions for people who are placed there just from any segment of the population, but more specifically, if individuals with IDD are going to be placed there, to ensure that the staffing is appropriate, that the staff are appropriately trained, that the programs are in place to make sure people with IDD can receive the help they need while they're being treated for their behavioral health challenges as well. So we feel like there was a positive outcome from that, and more work continues to be done. More work will be reported to you on in the fullness of time. We continue to have issues with council vacancies. There are people who come and go from the council for a variety of different reasons. The biggest challenge we're facing, I think, right now is the fact that the governor's office of boards and commissions is substantially behind on appointing or reappointing members to these public bodies all over the state. We're not alone, but we have positions that have now been in the works for more than a year, and the appointments have not been made. Currently, we have an open position for our Division of Aging and Adult Services, mandatory slot. That's the one that's been in the process the longest, since September of last year. And for whatever reason, the person who was nominated has not been appointed. We have a vacancy now that James Rivera has resigned from the council because he left the Department of Education. We now have a vacancy for a Department of Education representative. We know that, and we didn't announce this, I don't think, but Ben Kaufman, who is our access representative right now, is going to be stepping aside. CJ Loisel is going to be replacing him, just as JC Farkas is going to be replacing Wendy Parent-Johnson from the Sonoran USED. All of the applications for these positions are in the works, but we don't know when they are ultimately going to be acted on. I stay in touch with boards and commissions as often as I can without fear of retribution from them, but it doesn't seem to be making much of a difference at this point. In any case, we will report to you as those vacancies are filled. It's just a little disappointing that things are taking as long as they are taking. We realize there's due diligence to be done, but it seems to us to be taking an extraordinarily long time, an unreasonably long time, to get these positions filled. I would also point out one other vacancy that's soon going to affect the council, and that is Steve Freeman, our Director of Communications, has submitted his resignation. I believe you all received a note from Steve earlier this week. I want to express particular thanks to Steve. He has been a member of the council in the past. He has been an advocate for people with IDD in the Down syndrome community and other communities for decades. He is a parent. He has a strong commitment to this community, and I want to thank him for the work he's done for the council and wish him, as I think we all do, all the best moving forward. And we hope you will keep us apprised of what your next adventure holds for you, Steve. The annual report for 2022 was finalized and released last week. That was posted as well as the other documents for today's meeting. I encourage you all to take a look at that annual report. It is not a complete listing of all the things that the council did in 2022, but it is a pretty good overview of the more significant things we did and the ways this council is having an impact on people with IDD around the state of Arizona. So if you didn't get a chance to look at it, I encourage you to do so. I will be sending out a hard copy to all council members in coming days. So you'll have that to place on your coffee table, so all your visitors at home can take a look at it as well. If you, your organization, anyone you know needs a copy of the report, please let us know. We will be distributing it far and wide, but it's certainly possible that we won't hit everybody who should receive it. So let us know. We'll be happy to send that out to anybody. Finally, included in the packet of information were our proposed meeting dates for fiscal year 2024, starting November of this year, for both the executive committee and the full council. We are following the same pattern for 2024 that we followed for 2023. We will have a meeting in November, January, April, June, and September. And again, this is federal fiscal year 2024, which is the year on which the council operates. So it looks a little weird starting in November and ending in September, but please know that's just the federal fiscal year. If anybody objects to the dates that were posted, please let me know if there's a conflict. We certainly try to avoid any conflicts, but if you have any issues, please let me know. As I said, both executive committee and full council meeting dates were posted. The only exception, we will, as always, be meeting on Fridays for full council. The only exception to the Friday meeting dates for the executive committee are that November 10th, which is a Friday, is celebrated as Veterans Day for state employees and for many other folks as well. So we will be meeting on Thursday, November 9th instead. That is everything from me for now. I'm happy to answer any questions you have. Kristen.
Thanks, John. I was just wondering, because we have the same challenges with appointments, and so wondering if ACL takes much umbrage at not having full spots, what the repercussions of that might be. We're trying to find our way through that with our, bodies, oversight bodies as well. So just trying to compare notes.
Yeah, the guidance we've been given is that as long as we are working to get those positions filled, they'll be patient with us. They understand the challenges, and I know that we in Arizona are not alone, because I've spoken with many of my colleagues around the country, and they say the same thing, that their offices of boards and commissions are very slow. I don't think there are many that are facing quite the backlog that we're facing right now. But they're also saying that it takes time. If this persists much longer, I have a feeling that ACL may, question us on why this is happening and what steps we're taking to speed things up. But I've had conversations with the governor's health policy advisor. I've had conversations with their human services policy advisor. I've had conversations with the director at boards and commissions, and they all say they're working. They all say they're trying to make it happen, but none of them can give a very satisfactory answer as to when we're going to see some progress. So I think we're okay as far as ACL is concerned for now.
Okay, great. Thank you.
Sure. All right. Thank you.
Well, don't go away, John, because you're up
Okay.
next with agenda item E, our federal fiscal year 2024 council budget.
Okay, Lonnie is going to putting up on the screen our proposed operating budget for federal fiscal year 2024. It turns out that this is something the council has to approve on an annual basis, and I was not aware of that a year ago. And so we operated without a council approved budget, but we're going to fall in line now. And what we're presenting to you, it is, I think, pretty simple and straightforward. I've asked Lonnie to provide some additional detail here, but basically you can see that we have an administrative section and a grants and projects section. We don't handle a lot of functions, or there are a lot of functions we don't handle at the council. They're handled by DES, which is our designated state agency. So some things are not reflected in great detail on here, but Lonnie can provide more information if you have questions. I think what I would simply say is that we are projecting level funding for fiscal year 2024, and that is on the guidance of our ITAC, our technical assistance folks, and the folks at ACL who consult with us. There have been discussions in the past, we know, about potential for funding cuts. The latest word we've gotten is that we should just plan for level funding. And so that is what we've done. If we need to make adjustments moving forward, we certainly can. Lonnie, do you want to explain some of the areas that might be of question to people?
Sure. Thanks, John. So just starting with the administrative operating budget, this is based on 30% of the full award amount, which John had mentioned is at level funding right now. However, we don't anticipate spending this entire amount. Rather, we more likely will spend closer to $280,000. And so what happens there when we're not spending our entire allotted administrative budget, that those funds become available for grants and other projects. So we're anticipating having 170,398 that can be used for grants and projects. And so this is the 1,050,930 is reflective of 70% of this level funding. However, with the additional admin balance, we're anticipating to have 1,221,328 to be used towards projects. A couple of things to kind of note. It may look strange that personnel and benefits are so low. This is strictly for administrative purposes. As I kind of mentioned on the previous budget sheet, there's a program administration line for each of our grant areas. And so that's where the rest of the personnel and benefit costs are reflected. Also, occupancy, there's nothing there. And of course, we are paying rent, but that's something that, as John mentioned, DES kind of takes care of. And then capital equipment, there's nothing there as it's not allowable. Does anyone have any questions on this budget?
Does that mean that we have to spend it all?
That's what we would like to do and what ACL would prefer us to do. So our goal is to always spend the entire amount, Mecca.
But I mean, what if we don't? Does that mean does that mean there's something wrong? I mean,
no, sometimes grantees are unable to spend their full amount, and we try to anticipate that and come up with contingency plans and projects to cover what isn't fully spent. But in the case to where there's nothing that can be done, those funds are reverted back to the feds. And so we just no longer get them anymore, and that money goes back to ACL.
okay.
Lonnie, this is Kathy. How is that related to our work plan? Do we need to, I mean, we're going to meet, but do we need to create other activities in the work plan in order to spend that funding?
Those have actually already been identified through the work that you guys have done through the work plan committee.
Okay.
As we move forward, we're going to be looking into what we plan on doing with 24 funds, which will be the 25 work plan. So we're kind of good for 24 at this point. But again, should something go sideways and we need to find additional projects to cover, let's say something that isn't being spent, then yeah, we will probably send it your way.
Okay, thank you.
Any other questions?
Yes, this is Kim Counts. Of course, I'm not a member person. I just wonder, since we have the extra funds, are we able to look at like other goals that, other than those that is stated there, like self-advocacy and things like that? Can we re-examine and say, you know what, maybe we can look into some other areas as well that the funds can go into, the other objectives, other goals?
Well, Ken, right now we don't necessarily have excess funding, and to create another goal area at this point is quite a lengthy process. That would be something that would need to be discussed with the entire council and would need a 45-day public comment review. So adding a new goal area is a very, very big process. And wouldn't be an ideal situation as far as redistributing funds. But yeah, if the council feels that there's a need for new goal areas, the best time to look into that is really with the new 5-year state plan because of everything that goes into creating a new goal. It can be done, but there's a lot that goes into that. So finding projects that fit within the predetermined goals is the best way to spend funds that aren't allocated.
Thank you.
Sorry, Ken.
Thank you.
Mary?
I think everybody is kind of pointing in the same direction. It's like, okay, what do I get to do with that money? Which is part of the reason I think that other committee has been formed to look at, wait a minute, how can we enhance what we have going on here? And so I think for Ken, it's like the goals that we currently have are so broad that you can fit just about anything you want to do into them. So knowing, I mean, I'm sitting here knowing that $70,000 might become available sometime. This is the time to start thinking about how you might want to be creative with a grant or a contract in the future, and how it might fit into those goals, because the goals are so broad that we can fit a lot into them, I think. And that's just my opinion. So.
Yes, and most of this has already been predetermined. Let me go back to this other sheet. So while we're in 2024, we're primarily going to be spending fiscal year 23 funds. And so most of the projects have already been identified for what you're seeing in this proposed budget here, if that makes sense. So again, Kathy, we don't have anything for our fiscal year 24 funds because we haven't been awarded that yet. That will fall within, it's supposed to happen October 1st, but who knows when we will actually get any kind of award for fiscal year 24. But that will then determine what we're putting in our fiscal year 25 work plan. Sorry, I know we're dealing with 3 open grant years, which makes it a little bit confusing. So any other questions?
Thank you for your explanation, though. That's helpful.
Any other questions?
Lonnie, I could add in something that might maybe confuse everybody, but hopefully some folks who have been on the council in the past remember that we used to do requests for informations, RFIs, and that was when we had an excess amount of funds that we could not fit in an existing objective or activity. And so we issued public calls for really 2 very brief proposals that the council can review and consider for our work plan in the future, so that any excess funds could be expended and awarded. So we have not done that because we made a really good effort at having a number of contracts in place and been overseeing their budgets to make sure they spend the money down. If there is that case again, believe me, Lonnie is aware of it. She is communicating it with John and with the council, so that if there is a case where we need to think about future planning with excess funds, we want to look at our existing work plan, and we can add new activities under an objective with relatively ease when we update our annual work plan in August. It is more difficult, as Lonnie stated, to add a new goal because of all the pre-work that has to be done a year in advance. So it's not really ideal to do. We have 5 goals and we have a lot of activities, and we have to make sure that we have the staff or the grants available to carry out any sort of work right now. So, but it certainly can be considered adding new activities under our existing objectives.
Thanks, Marcy.
So Melissa, if there are no more questions, I believe the council needs to vote to accept this as the operating budget for fiscal year 24.
You are correct, sir. No more questions. If you have questions, speak up. Otherwise, we're calling for a vote. Okay. I'm going to call for a motion to approve the ADDPC federal fiscal year 2024 administrative budget. Do I have a motion?
This is Mary. I'll make that motion.
Thank you, Mary. Do I have a second?
This is Vijat. I'll second that.
Thank you, Vijat. All those in favor of approval, please say aye.
Aye.
All those
Aye.
opposed, sorry about that. All those opposed, please say nay. Is anyone not voting? Okay, thank you. Budget is passed. Thank you. Moving on to agenda item F, our community and our work, our committee and work group report outs. Happy Friday, everybody. First up is our grants committee with Monica. Yeah, it's true, Kristen. Hey, Kristen, I signed on at 9 o'clock this morning and called John and said, why is nobody letting me in? So I'm really glad it's Friday.
We met like 2 weeks ago, and Marcy and Lonnie and whoever, can you guys summarize, please?
We will be glad to. Lonnie's going to help with showing the proposals. And this is Marcy. I'm going to be doing the overview of 4 proposals and individual votes for each, please. And then I will designate John to speak about the last one. Thank you, Melissa. So the first one up for review and discussion is Impact Analytica, who is supporting our Disability Data Hub. This is for a 3rd-year funding at $20,000. The Disability Data Hub, which is currently on our website, is maintained and updated by Dr. Alex Kurse, who is with ASU. It offers state and county specific disability statistics in a user-friendly dashboard. The format is based on 6 domains currently, which includes demographics, income, education, employment, housing, and transportation. The data is cited from the Census Bureau's American Community Survey and American Housing Survey. In this 2nd year, Dr. Kurse, with assistance from the council, finalized a data sharing agreement with DES to source local data collected by DDD going back to 2016. Moving forward, this will allow for more statewide focus on IDD data that Division of Developmental Disability collects on who has provided support and services from them. By supporting the 3rd year of funding, Dr. Kurse will update the dashboard 6 domains as general disability data becomes available. He will continue to work with the council and DDD to facilitate discussions of specific Arizona disability data to host on the Disability Data Hub by creating a new dashboard for DES data sets. Once these data sets are updated, Dr. Kurse will plan for webinar training sessions on how to use the Data Hub and track website usage and specific questions from users. Council staff has ongoing communication with Dr. Kurse. During both funding years, there have been no contract obligation concerns with this grant. Any questions? Okay.
Okay, if that's all, are you ready for a vote on that one, Marcy?
I think so, if there's no questions.
Okay. Hearing no comments or questions, I'm going to call for a motion to approve the Impact Analytica Disability Data Hub 3rd year funding in the amount of $20,000. Do I have a motion to approve?
This is Vijette, so moved.
Thank you, Vijette. Do I have a second?
Second.
Was that you, Sophie?
Yes.
Okay, thank you, Sophie. All those in favor of approval, please say aye.
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 Aye. Aye.
All those opposed, please say nay. Is anyone not voting? Okay, motion is approved. Thank you.
Okay, thank you. The next one up is the Arizona Center for Disability Law, SEEP, which is Special Education Advocacy Program, requesting 3rd year funding for $150,000. The ACDL is requesting SEEP funding to address the gaps and needs by students with IDD, along with their families and caregivers to understand their rights in special education system. SEEP continues to provide technical assistance in basic and complex forms and resources to the target group, giving priority to youth in the foster care and or juvenile justice systems. And in this current 3rd year, they're going to target Arizona's refugee community and Native American students in the 4 corner regions. In addition to the technical assistance provided, funding also supports ongoing training sessions to reach out to new groups. They will conduct 8 training sessions throughout the next year, approximately 2 per quarter, either in person or online webinar on a webinar format. Training is provided statewide, educating various audiences, including 1 training in Spanish, 1 for Arizona's refugee community, a training in the Four Corners region in collaboration with the Native American Disability Law Center. And then other audiences include the Juvenile Court Dependency 101 Judges Training, Early Childhood Professionals, ECHO, the Department of Child Safety, and at the African American Conference on Disabilities. ACDL expects anywhere between 15 to 20 participants per training. Multiple partners in the community support SEEP, including the State Department of Education, Department of Child Safety, and Administrative Office of the Courts, and multiple nonprofit organizations such as Raising Special Kids, Foster Adopt Connections, Black Mothers Forum, Casa Children, and Advocacy 319. ACDL is highly unique to carry out this work. They are a nonprofit law firm with legal staff that includes attorneys and advocates who are highly knowledgeable about the various legal rights of individuals with disabilities under the American with Disabilities Act, Section 504 of the Rehabilitation Act, Section 1557 of the Affordable Care Act, the Fair Housing Act, and other federal and state disability rights laws. ACDL is one of the only entities in Arizona providing free legal representation and advocacy services related to education and transition to employment needs for children and young adults with developmental disabilities. ACDL represents children in negotiations, mediation, administrative compliance before the Arizona Department of Education and the U.S. Department of Education's Office of Civil Rights, and due process proceedings in Arizona Office of Administrative Hearings. Part of this third year will also include surveys, 2 surveys that they will use to track feedback from participants. The first survey is those who attend a training session, which will be automatic after a training session. Feedback is provided immediately, and then survey responses are tabulated and included in their reports to the council. A second survey will capture outcome-focused data on how technical assistance provided by ACDL staff resolves or does not resolve a client's issue, or if the issue is still in process of being worked through. These surveys are included as part of the proposal. Finally, ACDL's third quarterly report, which is what we have to date, shows in their second year funding that 76 basic technical assistance has been provided to families, 28 complex technical assistance has been provided to date, and they've conducted 9 training sessions. These numbers exceeded their projected numbers for year 2. Narrative report also provides specific feedback from families that receive services that we use as stories in our upcoming federal report. There are no contract concerns. The budget outlines various staff and interns that will be used as match from ASU and U of A Law School. Staff that have part in managing this project are listed and their time is projected. It provides a more realistic picture of work that is provided to conduct training sessions or manage a caseload of basic or complex technical assistance for families. Funds are also dedicated for translation and interpretation services, travel funds that allow staff to attend meetings, to provide individualized services, or meeting with community members. Any questions?
This is Kathy. I know JJ's not on the phone, and it just dawned on me. So is there a wait list of families or individuals needing help from ACDL that they couldn't get to? Or just putting people on the wait list till they can get to them? Just curious.
Do you mean under this contract, Kathy?
Yeah.
So
does it work like that? Can they have a wait list?
I don't know. I can't answer that question. I will only tell you what JJ, so their budget had increased in their third year from their second year. Primarily because they were seeing more of an increase in cases that they would like to offer assistance for. So in their second year, I think in an email early on in the spring, their staff said, we're not going to carry on anymore. I think the complex cases, the basic technical assistance is where a family member may call and say, I need a resource on something, that you have, that I've seen on your website. Can you provide me a hard copy? And I need it in Spanish, for example. But the complex cases are the ones that take more mediation, more meeting, more ongoing conversations with the school district, perhaps with the family member to work it out. I think they had budgeted a certain amount of funds because it is staff time. If you see the budget, you see all the staff listed, obviously they could eat through that budget pretty quickly. And this year, with 150,000, I think they're going to meet the minimum number of folks that they want to target, but they're also adding on working with the refugee community and the Four Corners region for the Native American population. Does that kind of help clarify? But
it does. It just, you know, it just makes me think, you know, where are our families going for complex, you know, assistance? It just made me think about that, going, oh my gosh, where are they getting referred to? Who's helping them?
Hey,
That kind of
Kathy,
thing.
if
Yeah.
in my experience, if it's not ACDL, I know a number of special ed attorneys in the state, and there are some really good advocates that know the legal system as well. So if families aren't going to ACDL, they're going to those other places. Now, of course, it's going to cost them money out of pocket, and it's a lot, but I think that's the only other thing they're doing.
Okay. Okay. That's helpful. It would be interesting, but not for this council, but just interesting at some point to see how many of those cases are getting served and helped, how many families are. And are we seeing an emerging issue? Is it rising? Is it decreasing? You know, what's happening in the education system? That's a discussion for another day, I think.
Well, Marcy, are they tracking all of those numbers under this grant?
yes, they are.
Okay. So it is something that we could ask for at some point, or the next quarterly report. Are they doing quarterly report outs on those numbers, or is it just
Yes, they are. So part of their data collection is tracking how many basic technical assistance cases they handle, calls coming in, easy referrals that they're able to provide immediate information out. And they're going to be doing a follow-up, 3 months to just call families to say, did the information help? Do you need more information, a different referral or something like that? So they're going to be following up with those families as well. The complex ones take more time. They do plan on following up with those cases once they are complete to make sure that their case is corrected and handled and there's no more concerns, or if they need to reopen it up again. So 3 months later, after a case closes on a complex, they'll follow up with those folks. So the training that they do around the state, either in person or on the webinar format, they're going to do 8 of them. And they'll conduct a satisfaction survey. They'll provide that information back to the council in their reports. So at the end of the year, like projected in September when their current contract ends, I will get a very large narrative report from them, and they'll provide all the data collected to date and some stories of individuals who have received assistance, which is really helpful and nice to see because we can share that in our federal report.
Okay, thank you. That's helpful. That's good to know, because like Kathy, I'm always curious too on what those numbers are. And Gabby,
Yeah,
and go ahead.
Sorry, I just think that, from that report, we can look to see if there's any emerging issues that maybe, council can help with down the road, or just see it coming. Yeah. Thank you.
Absolutely. And good point there. Gabby just mentioned that Gagne has helped many families free of charge, primarily Spanish-speaking families. And thank you for doing that, Gabby. So I know a lot of people in the community that have done advocacy for free. I'm one of them, but sometimes, if it's something that's going to be highly legal, I refer them on to multiple other sources, including ACDL and then the other attorneys that I know. Okay. All right. Are there any other comments or questions on this grant proposal? Okay. Hearing none, I'm going to call for a motion to approve the Arizona Center for Disability Law Special Education Advocacy Program, SEAP, third year of funding in the amount of $150,000. Do I have a motion?
This is Kathy. I move.
Thank you, Kathy. Do I have a second?
I second, Gabby.
Thank you, Gabby. All those in favor of approval, please say aye.
Aye.
Aye. All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion carries.
Okay, thank you. Good questions. Thank you, Kathy, and Gabby as well for your feedback. The next one is the proposal third-year funding from the Arizona Coalition to End Sexual and Domestic Violence, requesting $35,000 for their education to reduce abuse training, ACES-DV. So I'm just going to abbreviate it for purposes of making it easier. ACES-DV is requesting this third-year funding from the council to provide 4 training sessions, 1 in person in Kingman, and then 3 virtual training sessions to attract a higher number of participants from the state around, and especially around from rural parts of Arizona. They plan to specifically target populations in the rural and Spanish-speaking community and sexual and domestic violence service providers for the IDD community, including staff at group homes and long-term facilities. The training sessions are free of charge. They're 4 hours in duration, and the content has been updated with input by the ADDPC and the ARC of Arizona to ensure terms and descriptions of people with IDD are accurate. All training sessions are also recorded, and the course content currently includes the following. First one is Sexual Violence 101. The second is Introduction to Addressing Sexual Violence in the IDD Populations. The third is Introduction to Disability and IDD. The fourth is Mandatory Reporting and Retaliation. And the fifth content session is Sexual and Domestic Violence Among Children with IDD. As stated, ACES-DV staff reviews their current training curricula with assistance from the council, the ARC of Arizona, and they're going to pull in and partner with AZ-SILC, the Arizona Statewide Independent Living Council. It will include Spanish interpretation, rural and Spanish-speaking community information, and information about abuse against children with IDD. After each training session, participants do fill out a satisfaction survey to gauge their understanding and usage of the information. In their second year grant, which also will complete at the end of September, a total of 328 participants attended a training session, of which 10 were from out of state. Participants came from all 15 counties, which is a first for any of our training grantees. The data also showed that 30 participants were individuals with IDD and 21 were family members and caregivers, and the majority were professionals in the community. Feedback remains positive, with 98% stating they were satisfied or highly satisfied with the training and information provided will be used. The budget reflects costs that will support the activities in the third year. They are seeking clarification on the costs related to outreach efforts, ensuring requests for accommodations can be met. We did receive an email stating that they're going to include that in their budget. And then they're also going to provide demographic data to the council as well from the training sessions. There are no concerns with their current contract. And again, this is a third year final proposal from ACES-DV for $35,000. Any questions I can help address?
Okay, hearing no comments or questions. If you have nothing further to add, Marcy, I am going to call for a motion. Okay. We're going to call for a motion to approve the Arizona Coalition to End Sexual Domestic Violence, Education to Reduce Abuse, third year of funding in the amount of $35,000. Do I have a motion?
Motion.
Thank you, Sophie. Sophie. Do I have a second?
This is Mary. I'll second that.
Thank you, Mary. All those in favor of approval, please say aye. Aye.
Aye.
Aye.
Aye.
All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion carries.
Okay, thank you. Final one for review and approval is the proposal from the Sonoran University Center for Excellence in Developmental Disabilities, requesting $120,000 third-year funding for the Native Center for Disabilities. The mission of the Native Center for Disabilities, or Native Center, is to provide Native-focused programs to increase knowledge of disability services, advocacy, and programs available to the 22 tribal communities in Arizona and off-reservation urban communities with significant Native American populations. Funding for this third year is to continue the tribal partnerships that are in place and support further outreach to the other tribal communities that are not yet part of the Native Center work. Partnerships with the tribal communities aim to further develop activities fostering awareness, services, and partnerships benefiting the Native people. This is done by providing culturally sensitive programs to amplify awareness of disability services, advocacy, and support within the Native American populations across our state. With initial funding in year 1 and in year 2, the Sonoran USED initiated foundational activities to establish its presence that included talking circles, monthly webinar presentations, quarterly newsletters, and outreach efforts that led to face-to-face meetings with 10 tribal communities and to communicate the project objectives. There was also outreach efforts to partner with federal and other state and community organizations about the need to support our tribal communities. A list of the 10 tribal communities that staff visited is on page 2 of the renewal application. The Native Disability Center, or Native Center, has built and continues to partner with multiple tribal communities, federal and state and local agencies. The program is focused on sustaining this project with guidance from the tribal communities involved with their ongoing support with USED staff. Fundings for this 3rd year will allow the Sonoran USED to focus on 4 main objectives. The first is to expand outreach to new tribal communities to form new partnerships with them. The second is to create diverse employment opportunities for adult individuals with disabilities by supporting culturally responsive training programs to match the skills and aspirations of their members. The third is to form a partnership with the U.S. Department of Labor, Division of Indian and Native American Programs to develop a national technical assistance training materials. And the fourth is to create additional awareness and resources for certain specific disabilities, including autism, comorbid mental health with developmental disabilities, traumatic brain injury, and fetal alcohol spectrum disorder. These resources will include informative materials, training modules for caregivers and professionals, and online platforms for sharing the experiences and knowledge. One of the key aspects of the Native Center is the commitment by the Sonoran USED to support the targeted disparity mandate, which is a requirement of the ADDPC in our annual work plan. The targeted disparity is to increase meaningful employment opportunities for transition age youth with IDD, which is ages 14 to 22, from the Navajo Nation specifically, by supporting a focus on training, technical assistance, direct services, and resources. This has progressed through the creation of maintenance and partnership with pre-employment transition services, project search, school pilot site partnerships, and tribal state folk rehab employment supports. Data to date in the reports have shown 81 individuals with IDD, 32 family members and caregivers, and 631 professionals have participated in some sort of activity by the Native Center, which whether it's a talking circle, webinar, or approximately 97% of respondents stated their knowledge and or skills have increased by attending one of these events. Their budget for 3rd year supports the ongoing activities for the Native Center, including staff and for consultants. One of the key areas I do want to point out that we have worked with Wendy prior to her leaving her position is, and we have also received a clarification on this, is that the hiring of the program manager, we want to ensure that the Sonoran USED places a primary priority of that within the 1st quarter if awarded to ensure that that position is filled. With that, there are no other concerns. I'm happy to answer any questions.
Marcy, I'm just curious, but how long have they been looking for a director? You know?
Part of the 2nd year. So I believe the person came on board midway through the 1st year, did not stay very long. I don't have, I would have to look in the file to see when that person left, but Wendy did pick up much of the responsibility of the work of the program manager in the 2nd year.
Okay.
And so that position is currently out. My understanding is they're currently looking or to hire someone soon.
Okay, because I had remembered they filled it, and then I just was curious how long it's been vacant. Who's running the day-to-day in the meantime?
JC.
JC, okay, because
And I
JC.
do want, yeah, and just in the scroll down, if you see in the proposal, Wendy is still active in this contract.
Yes.
So she hasn't walked away entirely, which is Wendy, and we really appreciate her being part as a consultant to this contract, along with Jim Warney, who has been part of this contract since the first year.
Sure. Yeah, I'm grateful too, because that's a lot. I'm sure JJ has a very full plate right now, or JC, sorry.
They both do. Yes.
All of them, that's right.
Yes, and we're very grateful for JC stepping up. So
yes, thank you. Any questions other than mine for Marcy? Clarifications? Okay. Hearing none, I'm going to call for a motion to approve the Sonoran Center for Excellence in Disabilities Native Center for Disabilities Year 3 funding in the amount of $120,000. Do I have a motion?
This is Kathy. So moved.
Okay, there were two. So I heard Bijette. Thank you. And then the second. So whoever just also.
Kathy, I'll second it.
Okay, thank you, Kathy. All those in favor of approval, please say aye.
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 All those opposed, please say nay. Is anyone abstaining? We're not voting. Is JC abstaining from this? Is she still on the call? Okay, I don't think she's here anymore. So there's
I'm
no
here,
point.
but I didn't think I could. I'm not a voting member because I'm not on the council yet. Is that correct?
Yeah, that's correct. I'm sorry. I know you're here in Wendy's place, but in order to officially vote, and that's my mistake. So, but it's one you would have abstained from anyways.
Yes.
So, okay. Thank you so much. Motion carries. Okay, thank you. We do have one more thing on the committee work group, and that's the ARC of the U.S.
That's going to be John. Thank you, everyone. I really appreciate it.
Thank you.
All right. Thank you, Marcy, for the presentation of the other grants. We did want to touch very quickly on the third-year renewal proposal that we received from the ARC of the United States for the Arizona Sexual Violence and Disability Network program coordination. As is clear from the fact that we are continuing our funding for ACES DV and their training programs for IDD providers, the issue of sexual violence continues to be very top of mind for the council. It is a critical issue for the IDD community in general. And as you know, the council has been supporting the ARC of the United States and the ARC's National Center on Criminal Justice and Disability for the last 2 years to work on building a network of individuals and organizations around the state focused on better response to sexual violence and better prevention of sexual violence in Arizona, especially as it relates to the disability community. We fully anticipated a third and final year of funding for this project. But what we saw when we received the renewal request was, or what we determined as we reviewed it, was that a tremendous amount of the work, the vast majority of the work on this project had been what I'd say was very inward focused. It was very much focused on the players who are part of that network, and appropriately so to a certain extent. But we felt that kind of inward focus went too far, and there wasn't enough focus on the actual impact this network was making in communities around the state. So there was a lot of work done to get the right people in place, to build a strategic plan for the network, to include more diverse audiences. There had not been any Native American representation. There had been very little Hispanic representation. So those things developed over the course of the first 2 years. But beyond that, there wasn't a strong view, in our opinion, as to how this network was then going to translate that work into actually making a difference in response and prevention around Arizona. So we looked at the proposal. There were a couple of budgetary issues that kind of raised eyebrows as well, but mostly it was the design of what they were planning to do in the third year, which would have been further development of the network and further focus on the network and its internal work groups. So we went back and we asked for some clarifications. I got some additional information. The initial clarifications we got didn't do much to add to our sense of comfort about where this was going to go. I had a personal conversation with the person from the Arc of the U.S. who was leading the project. And unfortunately, what they were able to provide us just, again, was, in our opinion, was not really substantive. It didn't really lead us to believe that a whole lot more was going to be done that would merit our continued investment in that particular work. Subsequent to that, unfortunately, we did learn that there are some plans for sustainability of the project, for greater outreach, for involvement of additional players, including ACES DV, including the Arc of Arizona, including ACDL, and some other folks that potentially could have greater on-the-ground impact. But none of that was provided to us in time for the proposal review. None of it was provided to us in a written format that would actually allow us to evaluate its merit. And so as a result of these various factors, we as a staff, when we initially reviewed the renewal proposal, we felt that it did not merit presentation to you as council members for ongoing funding. Instead, our proposal is to end the funding for the Arc of the U.S. on September 30th when the no-cost extension for that project comes to a close, and next spring issue a new solicitation focused in some respects on the same work, but also perhaps better clarifying what we as the council believe needs to be accomplished to touch the IDD community and to actually move the needle on prevention and response around the state. So again, we were not recommending a renewal for year 3 for this project, but we do intend to revisit the scope of work, adjust the scope of work for this sexual violence response, and issue a new solicitation in the spring, which would be open to the Arc of the U.S. It would be open to any organization that wants to apply, but ideally to do it in such a way that we could issue a new contract to begin on July 1st of next year, so that there isn't too big a gap in the work that's being done, and there's an opportunity to as much as possible, keep the momentum going for the good things that have come out of this project, just to more tightly define how it's going to affect people on the ground around the state. So I hope that all makes sense. We are committed to this work. Erica started this work even before Hacienda. Hacienda was really a catalyst to bring in more players to really kind of bring people's attention to how important this is, and it hasn't gotten any less important in the years since. So we are committed to continuing the work as council and as staff. We just want to make sure that it is having the right outcomes, that it is having the level of impact that it really needs to have. And so that is our proposal to you, and that is why this renewal request was not brought to you for approval at this meeting.
One question, John. I understand because you and I had discussed that. What was the requested amount for that project?
It was $50,000.
Okay. I was curious on the amount there. All right. Well, I fully agree with you. So I'll be curious to see what that new scope of work looks like, and hopefully we can keep it going with some expanded outcomes, direct impact. Okay. Are there any questions for John or comments? Okay, hearing none. Thank you, John. We're going to move on, and Marcy for that. We're going to move on to system access and navigation. Mary had been chairing the committee for this. Mary had to leave our meeting. She had to go. Mary is still involved with the work, closely watching it, but Jana is now the new chair of the System Access and Navigation Committee. Jana, I do believe you're on this call. Mary said she has faith in you and John together.
Mary has so much wonderful faith. And what I'm going to do is I'm going to really rely on John for our first report because I am really new to our systems access group. So John, could you help me with our update for our group this time? And then I will be ready to take it next time.
Yeah, I'll do my very best.
Thank you.
The System Access and Navigation Committee met recently. It has effectively been meeting on a quarterly basis. We had a meeting not too long ago, and the majority of the time was spent reviewing a project that this committee has been undertaking for about a year, maybe a year and a half, maybe even longer than that, to develop a web-based set of resources to help families, in large part families who are relocating to Arizona, but it could be families who live in Arizona already, to help them locate the resources they need in order to navigate the service system based upon the age range of the individual who's a member of their family. So, for example, this web-based resource is being designed to serve the birth to age 5 age range, the 6 to 18-ish age range, the sort of K-12 school age, and then the transition to adulthood post K-12, and then the final component is the elder or aging age range. A lot of work has been done, and there are a lot of resources already available in that birth to 5 and K-12 in those two sectors. More work is being done to put together resources for the transition to adulthood, and probably the biggest challenge that's being faced, and one that's going to be aided by that public health workforce development project, is developing the resources for the aging and elderhood segment of the population. There is an intern, or well, she was an intern from the University of Arizona. Many thanks to the Sonoran USAID for connecting us with her, named Amber Owens. She had recently graduated from UA, but she's continued to work on this project on a voluntary basis. There is a current intern working with the council who is a senior in college, and she is also now working with Amber to do some additional research on that elderhood component. So there's the work continues. We are investigating ways that we can build these resources into the council's existing website. So at this point, the many resources have been identified. They can be accessed through sort of a mini website that Amber, the former intern, has put together. But ultimately, we want to incorporate those into the council's website, and we will continue working to develop an even more robust set of resources for that transition to adulthood and aging or elderhood segment. And we'll report more on those as we go along. This is an ongoing project, and one that, as you can imagine, is very near and dear to Mary's heart, as she has such a commitment to that elderhood component, and that is really the primary focus of the committee at this point.
Hey, Jana, do you have anything that you would like to add?
I don't think so, not at this time, but I think John did a great job describing kind of where we're at with the process right now.
Okay, well, thank you then. Any comments or questions for John or for Jana? All right, and Jana, thank you so much for stepping up into that leadership role. We really, really appreciate it. Thank you.
Of course.
I know you will do a fantastic job. All right, well, moving on to Meaningful Careers Work Up Plan Update, and that is me. But before I read you my lengthy notes, thank you, Mike, for that. I just wanted to mention, we don't report out on executive committee. There's really no reason to. It's kind of a little mini recap of what we do in here. I just wanted to mention that we do have a new executive committee member, and that's Bijette. And I just wanted to say thank you for being willing to step up and serve and give us some of your precious time. So thank you, Bijette. On executive committee. Thank you, thank you. Okay.
Thank you for the invitation.
You're welcome. We're so happy to have you. Yay, look at all those applause. Okay, so just to remind you all, our goal for the Meaningful Careers Committee is that by our federal fiscal year of 2026, ADDPC will increase the career potential of people who have intellectual and developmental disabilities and link them with resources needed to achieve their career goals. There are 3 objectives that support the goal. The first objective focuses on transition age youth, ages 14 to 22. The second on working age individuals, ages 22 and older. And the third on families and individuals that support them. In federal fiscal year 2023, Meaningful Careers worked on 10 activities. So the first, the Institute for Community Inclusion, University of Massachusetts, Boston has completed this last week a draft report of their Arizona VR report on transition for youth with IDD. The Council and Vocational Rehabilitation Leadership will have an opportunity to review and provide commentary on the findings. A final report will be issued in October, which will be shared with the Meaningful Careers Committee and then later on with the Council. Our second project, major project, the Center for the Future of Arizona is nearing completion of Communities at the Center, also referred to as the Raising Expectations Project, and will meet with the advisory group to present their findings around the issues impacting transition of young people with disabilities into post-secondary ed and career success. So during the past 11 months, the Center for the Future of Arizona and Arizona Town Hall have been engaging in cross-sector leaders to understand the challenges and opportunities for advancing equitable access and to identify opportunities and recommendations for actions so that we have better outcomes, right? From the very beginning of diagnosis all the way into adulthood. A final report will be issued in October, which will be shared with the Meaningful Careers Committee and later with the Council. But I did want to mention that we had a meeting a few weeks ago that was a town hall basically for this specific project. And we invited a number of people throughout the community from the different universities and some advocates and Voc Rehab, DDD. We had a lot of people there that were present for the conversation that was facilitated by the Center for Future of Arizona. Thank you for attending. Kristen, I know you were there, and anybody else from here that went. It was such a good experience. I have to tell you, we were so impressed with both the Center for Future of Arizona and Arizona Town Hall. I will look for ways to use them going forward in the future, certainly on this project. If you know, we may do other things on this moving forward. Gabby, thank you for being there. You offered great feedback and you've been so open and kind with your organization, Gagne, letting that group come in. And your families were very open with them and gave fantastic feedback. So thank you. I am so excited. I think we can actually do some things with this. Yep. And thank you to Mike. You've been very busy coordinating everything. Okay. So 6 new easy read materials were recently created to help individuals and families make informed decisions. So the resource materials are part of the Pathways to the Future series. So the first 2, to increase awareness of education and training and participation in underutilized paths for youth and young adults. The first resource, Apprenticeships Earn While You Learn, and Career and Technical Education, the second one, those were also translated into Spanish. The second set, to increase awareness of the career potential of individuals with IDD and to address systems change. The Imagine What I Can Do resource was developed to share information on the ABLE accounts Achieving a Better Life Experience programs. And then to help address the misconceptions about reduction in benefits for working adults with IDD, More Money, More Options, More Independence was also created. And then finally, to help youth with what their life will look like after high school. Hang on one second there, Jana. So they will go to, whether they will go to college or they will work, will they live on their own? We created a resource on transition plans. And then finally, to help with individuals who are exploring self-employment and entrepreneurship, we created Starting Your Own Business. So yes, these new resources are awesome and will be available on the ADDPC and Employment First websites, shared with families at resource and transition fairs, exhibited at the annual IDEA conference where they were introduced for the first time recently in August of 2023, just last month. And then they did receive reviews, and they were also shared with transition specialists. So our goal is to create a Pathways to the Future toolkit with relevant and timely resources to help resources for families and individuals to make informed decisions moving forward about transition in career and life outcomes as it relates. So yes, Mike, I don't think those resources are posted yet on our website.
No,
Not
they
yet,
will not.
they will be.
But they will be.
Okay, so I didn't think so either, but they're soon to come, Jana. So thank you, Mike, and thank you, Jason. Appreciate that. Okay, so October is National Disability Employment Awareness Month, or NDEAM, we call it for short. The council is partnering with the Arizona Developmental Disabilities Network, Association of People Supporting Employment First, or APSE, and vocational rehabilitation to educate individuals, employers, and communities on disability employment issues and to celebrate the diverse contributions of Arizona's workers with disabilities. This year's theme is Advancing Access and Equity and includes a series of training webinars on October 11th, the 18th, and the 25th. A media release, governor's proclamation, and infographics will be forthcoming. Hooray! And finally, so on behalf of Meaningful Careers Committee and the council, I want to recognize the individuals who partner and collaborate with us on important events such as the NDEAM, National Disability Awareness Month, Employment Awareness Month, our webinar series, Creating Successful Path, and activities throughout the year. Mary Fleck and Stephanie Johnson, VR, Natalie Luna Rose from the Arizona Center for Disability Law, Jules Hyde from APSE, Miles McDonald, the Institute for Human Development, Elizabeth Franco Jeffrey and Abel Young from the Sonoran Center for Excellence in Disabilities. And thank you, Kristen Mackey, JJ Rico, I know you're not here, Kelly Roberts, also missing, and Wendy Parent Johnson. So Kristen, you get all the glory today. Thank you so much for all that you have done, and that while Wendy's no longer with the USAID, she's done a ton to help us. And thank you to all those agencies and organizations for having such great staff who are always willing and enthusiastic to work with the council. We sincerely appreciate your dedicated staff. So y'all, thank you so much. Are there any questions or comments?
This is Kristen. I'll just say thank you all. Also, it's a pleasure to work with you guys and appreciate all of your coordination activities. So appreciate the collaborative efforts. It's proving to pay off. So, thank you.
I think so. Thank you, Kristen. Okay. Anybody else? All right. Thank you. Thank you. Let us move on to the behavioral health and IDD behavioral health crisis report out. Excuse me. Jason, would you like to cover that?
Yep, I'll do my best. So the behavioral health, just for a little bit on the behavioral health and IDD committee, started up about 2 years ago to write the crisis report, which is on our website. And after that, we decided to form a core group that has been meeting for about every 2 weeks for about a year, maybe year and a half.
Year and a half.
Yeah, year and a half with other state organizations and other MCOs or managed care organizations from around the state to get information and just to follow up on the gaps that existed in the report. Through that investigation or discussions, we determined that there still needs to be data provided, some data that's actually provided that can. So we decided the core group wanted to do a survey, which I mentioned last full council meeting that we were meeting with planning to meet, or we already did meet with the ASU, and they provided some great ideas and stuff, but they wanted to go beyond the scope of what we wanted to do. Also, the cost was a little over what we wanted, and also just their timeline was a little off, but we appreciate their great ideas and support. So we went a different route, and we contacted another 3 other organizations that do data collection, and we ended up settling with the Noble Predictive Insights This proposal is on the website, and so the committee wanted to bring this forward to the council for approval. There are some clarifications in this proposal, but I'll just go over. So what we want to do is conduct a survey of individuals with disabilities, family members of individuals with disabilities, and caregivers of individuals with disabilities about their interactions with the behavioral health providers, behavioral health crisis supports, and any other resources within the community. The reason we chose this group is because they offered if you look down there, it's a 6-week to 12-week timeline, which is kind of what we wanted. And the budget was friendly. It's 60 grand. And they have worked with Arizona, health department and the city of Mesa and the city of Avondale. Some of the corrections we want to make is that are not on here. They say first they say caretakers. It should be caregivers. That's not the right term. We want to make sure that the individual with disabilities is explicitly in there. And then one thing, it talks about using our mailing list, and we don't want to give anybody's mailing list out. So we talked to them about this, and they're just going to give us a link so we can put in our newsletters and distribute it that way. They asked us, the target goal is 200 responses. Obviously, we can go over that, but that's the targeted goal that we have. And that's just let's see. I think that's John and Melissa did meet with the group Noble. If they want to add anything, or if anybody has any questions, I'm happy to ask. Or I'm happy to answer them. Sorry, not ask. But anyways, the reason we want it within the time period, it would be good to have it by the end of December so we can help educate the Arizona legislatures on using that data so that they can use that to make policies and such and laws. So anyway, anybody have any John or Melissa, do you have anything to add? Okay, Melissa has her hand up.
I do. I have a couple things on that. Yeah, when John and I met with them, we were actually pretty impressed with their experience that they've had in this space. They know the disability community. They're familiar with our state agencies. They're already on our contracted, providers list. I don't know not providers, sorry, guys. Vendor, thank you, contracted providers for the state. So that already kind of helps a little bit. But they did have a familiarity, and their specialty is doing surveys, and they tend to be one of the least biased in the country. Our core group, and a few members in particular, had originally come up with our own survey questions, and there's quite a few of them. The core group, there's about 6 to 10 of us on there, but 6 of us that are regularly at those meetings, and we're all from a little different sectors. We will be working with Noble to finalize those survey questions. So they will be what we want on that survey and the information that we're looking for. We feel like DDD Access, they don't collect a whole lot of data. So when we bring information forward about specific cases and problems or issues, it needs to have a lot of information. I think they need to hear from the community and from people that really are experiencing these difficulties, and what better way than to give them some actual data and comments. So that was kind of what that came out of. People don't often file quality of care complaints because they are afraid of retaliation. So often when we bring things up to the state, to Access, to DDD, to the different MCOs, we often, well, we didn't know those were problems, or we don't hear those things. And people don't complain. They come to individuals like me and Cynthia McCluskey and sometimes the council. So we just would like to be as transparent as possible and provide as much information and feedback from the actual members that are trying to access the behavioral crisis system. And that's all, Jason. John, did you have anything to add?
No, I think you've covered.
Okay. Are any questions for Jason or comments?
Hi, yes, this is Christina. Will the surveys be available in Spanish to the community members?
Yes. Yes. Yes.
Yes, good question. That's in the proposal, but yes, they will be. They have their own in-house translation that they will be in Spanish as well.
Okay, I guess I did have one thing to
Thank
add.
you.
Sorry, thank you, Christina, for bringing that up. I did have one thing to add, and that is one of the other things that we need to work with the survey firm on. Part of their original proposal was that the survey would be done in English and Spanish, but what we haven't gotten clarification on is how they're going to reach some of the other ethnic or racial communities of Arizona, in particular Native American communities. I want to work with them to make sure that they have some reach into those communities and can in fact get responses from those individuals, because I feel as though if we're just focusing on English and Spanish speakers, we are probably not doing justice to the range of experiences around the state. So that will be part of our further conversations with Noble.
Thank you, John. Okay, any other comments or questions? Because we do need to take a vote on this today. Okay. Jason, thank you
No problem.
for that report out. Appreciated. Okay. So I'm going to call for a motion to approve the Noble OH Strategic ADDPC proposal for our behavioral health survey and the amount of $60,000. Do I have a motion? Is that Monica?
Yes.
Thank you, Monica. Do I have a second?
This is Vijay. I
All
second.
those in favor of approval, thank you, Vijay, say aye.
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 All those opposed, please say nay.
Hey.
Was that anything, Kristen?
No, you just heard me barking at my dog. Sorry.
It's okay. Mine just threw up all over my bed.
Sorry.
Do I have a second? Sorry. We do have that. Yeah, Monica and Vijay, thrown off a little bit, literally, by the dog. Thank you so much. Motion carries. Thank you for that. Okay. Number 5 under our report outs is our work plan review with Kathy.
Oh, I'm online now. Thank goodness my internet came back. I had asked John if he would put up on the screen the work plan, that the 2024 annual work plan that was submitted to ACL. And this work group hasn't met since June, when we helped develop it or refine it with the ADDPC staff, and then it was submitted for approval. We will be meeting again in October, on October 13th, to talk more about the work plan and see if there's anything else we need to help the council staff with in moving this work plan forward. You know, we do have 5 goals. We have many objectives. And it's a lot of work for our staff. So I just want to say I really appreciate all the hard work they put into creating this work plan and trying to, meet the questions, the requirements of the grant, but also what the council asks of them. So I really do appreciate all their hard work. I did want to point out a few things, that this work plan is a little bit different than the one we worked with in the group. This one has more output statements, outcome statements, and then it has, I think, performance measures. And I wanted John to explain what the just the example of objective number 1, what the PMs, what those percentages were for. And I encourage the rest of the council to just look at this work plan, because this is what the staff are going to be working on this coming year. And John, could you explain the PMs?
Yeah, I'm gonna take a shot, and then I'm gonna ask Marcy to chime in because she's much more familiar than I am. But in a nutshell, these performance measures are a set of evaluation metrics to help us determine what audiences we're hitting with the projects and programs that we are supporting. Then some of it is basic data collection. The number of individuals who participate, the number of individuals from different groups, self-advocates, parents, providers, or professionals. Some of it is a little more nuanced in regard to the policies that we're supporting or policy changes that result from the work we're doing. Marcy, would you mind maybe just going through those performance measures for activity number 1, maybe giving a sense of what they are?
Sure. Yes, this is terrific federal coding, which they're perfect at. In every proposal, we pull out, and proposals, as you could see, they designated how many, for example, let's just go back to SEEP, the ACDL Special Education Program. They were going to do 8 trainings, to professionals. They were going to do basic and complex technical assistance for a specific number of families. And what we do when we ask and see specific performance measures in applications, we then review the actual information that ACL provides to councils on the specific performance measures. We have to track them either as a self-advocacy project or either as a systems change. So basically, SEEP is going to be designated as a self-advocacy project. The grant that was approved in June by the council for the ARC of Arizona for the actual self-advocacy coalition, which is objective 1 for activity, is a self-advocacy project. So what you see here and this is just right now until we get into the project, and I may add other measures, is IFA or IA 1.1 speaks to the number of self-advocates that will participate in the ARCS project. And we listed 50 based on their proposal, a minimum of 50. So they may have more, they may have less, but the anticipated number of advocates to be a part of this project is 50. The next couple of performance measures related are in percentages because it relates back to a satisfaction survey regarding their participation in this project. So 2.1 is to track, after participation in the council supported activity, the percent of people with developmental disabilities who report increasing their advocacy as a result of this work. So the survey that they're going to create has to capture that, and then they will create, they will document that, and then they will report the percentage so that we can report it back to ACL and the PPR. 2.4 has to do with the percent of people who are participating now in advocacy activities. 2.5 is the percent of people who are on cross-disability coalitions, which is a mandate that they were going to have. And then 3.1 is the percent of people involved in this project who are satisfied with the ARC of Arizona. So that's how this is kind of formulated. If you go through the other work plans and the activities, again, this is the first goal. You'll see other measurements related to SC. For example, here we have support decision making. If you could just stop, Lonnie. The second objective, proposal is support decision making, again by the ARC of Arizona, approved by the council. You'll see that they're going to target 20 self-advocates, which is IFA 1.1, and then 1.2 are family members, and a minimum of 50 family members to participate in support decision making. So that's how we're going to track this. 1.4 are professionals, so an estimated minimum number of 50 professionals. So those could be educators, support coordinators, anyone who is not a self-advocate, anyone who is not a family member of a self-advocate is classified as a professional. And then SC15 is one that basically lists, it's a collaboration grant. So we have a coding that we have to use, It's messy. It's something that takes a lot of time to understand. But we wanted to put this in the work plan so that we have a way of tracking it ourselves and communicating this back to the committee that Kathy is helping to staff. So I hope that kind of clarifies a little bit.
And just to provide a little extra context, there are about 24 different performance measures that we have to take into account. Not all of them apply to every project or program. As Marcy said, some are related to advocates and self-advocates, some are related to systems change efforts. We determine which ones are appropriate to apply to the particular activity. And then we report on our progress against those things during the program performance report of the PPR that we submit every year.
Thank you.
Thank you. That was helpful. So at one point, it would be nice if we could see all of the performance measures, but we can talk about that. And I'd like the council to see all those performance measures. I think it would be maybe at some point we could have just a presentation on them so that we're reminded of what you guys are working on. But other than that, we will be meeting October 13th with the work group committee. Anyone who's interested in working with us is, encouraged to join our group. But once again, this council staff are working very hard, and I really appreciate all the work that they've done to go into this work plan. Any questions?
I don't think so. Kathy, thank you so much. I know that it's a lot to think of on that committee when you're chairing it, and you're doing a great job. We really, really appreciate you. And
Thank you.
You bet. I'll see you on the 13th. Okay. And if ever you have questions about the work plan, John and Kathy are there, as well as the rest of staff. So we do welcome any participation if you want to give it, even if you just want to drop in. Okay. Thank you so much for all of our committee report outs. Appreciate all of you and all of our grants. I'm going to get you guys out of here on time and maybe early today. Agenda item H, a call to the public. I do believe we had some public members on here. If you guys had anything you wanted to say. Go ahead, John.
If I could just take a step back to item G, the announcements. I just wanted to quickly apologize. I mentioned earlier, and this is probably out of bounds, and I apologize for that too. I mentioned earlier that our annual report was ready and that it was shared with all of the council members in the posting. I didn't give credit to Jason Sneed, who did the vast majority of the work on the annual report. So I want to make sure that he is recognized for what I think is really exceptional work in putting that annual report together. Thank you, Jason. It was a team effort by everybody on staff, but Jason was really kind of the hub. And so I appreciate that.
Thank you, John. And I apologize. I guess I should have my glasses on when I'm looking at the tiny print on the agenda, huh? I missed the announcements. Before we go on to call to the public, are there any other announcements that any council members would like to make? Okay. Thank you, John. Hearing none, I am going to go back to where I'm supposed to be now. Agenda item H, our call to the public. Okay. All right. Steve mentioned that there is an ABLE presentation in Tucson, and if you are interested, you can look in the link for that. Yes, and that work plan committee meeting is October 13th, and it will be virtual. Okay. Okay.
Public input, Ben. I'd like to add my public input and be closed.
Okay. Hello there.
Can you hear me?
Go. Yep.
Can you hear me?
Yes, we can hear you just fine.
Okay. Public input. Northern Arizona, Mr. Delgado. I serve as advocate support for parents groups and compliance for ADA. I just want to make just 3 short lines. First, I want to say with the Disability Awareness Act, we're we're putting out a press release and getting a copy of the proclamation, and we submit it to the press. And then we submit the other one to the Chamber of Commerce to put it on the business network for information getting ready for the holidays. And quoting them, and we add also that we are your extra help for the holiday. Give us concern, and we'll be ready to work. That's the first one. I thought that'd be good. And what's out from other states, and I think that was good. I also want being worse. I also want to have. Did anybody have an update? Or perhaps John could give us some information on two things I want to ask. The first one is anything developing new and changing minimum wage. From what I heard, we only had anywhere. Well, I heard different numbers. 15 to 19 states have it. That's not too many out of the 50 that do have it. And what's the status for Arizona? Has been any discussion or input or on a national level? And John, I want to ask you this third question real quick. Like, have you had any new information on the art practices and possibly, I believe they have a state convention or anything doing in their advocacy or update that you might add since you were former director of that agency? That's all. Could you answer those three questions real quick, like?
Okay, I'm going to have to apologize. I didn't hear the first and second. The third regarding the ARC, honestly, I don't know what their plans are, but I'd be happy to put you in touch with their new state director and facilitate a conversation between you and her if you would like. But I can't speak to what their plans are. Would you mind repeating first and second questions?
Yeah, the first one is that we have had, and what I'm doing is put another press release with a copy of the proclamation, the governor's proclamation, and we give it to the press and see what happened. And it happened in other states, and we tried it here. And then the other one would go to the local chamber of commerce, so they can put it on the internet for all the business people, so they can have information getting ready for the Disability Awareness Month. And we add that, where are your extra help? And in Dallas, I had a good report that they done something like this, and it worked out real well. And on the second one, I was asking, relating to work, have you heard of anything developing in the sub-minimum wage that's been a plan for a long time? And because all we get mostly is trainees for 10, 12, 15 years in these workshops and some of the other places that do employment first. And that's about all I need to know. Have you heard any new updates on these two areas at this point?
So the first one, I'm not sure which proclamation you mean, because there have been a few, Mr. Delgado.
Right. It's a good proclamation on development of Disability Awareness Month.
Oh.
The governor puts it out. It's a nice proclamation and report. It puts it out once a year. And it just like any proclamation, then any celebrations, it's like government. And we just add a note with ours, the press release, right? And and to add it to our local level, since we're a rural area. And then the other one goes to the Chamber of Commerce, so they can put it on the local network for businesses getting ready for the holidays. And then we add the proclamation with the note saying that we are the extra holiday help. Please give us a concern and give us a call at local agency. And I thought that was good. In Dallas, I got a report that they did that, and they did real well with that. A lot of people were really getting hard for extra help, and I thought that was good. That was my first one, if you understand what I'm saying. And the second one related to that is anything new developed on the sub-minimum wage change, because I hear different numbers, 15, and maybe I heard 19 states out of the 50 that we had. Still got a long ways to go on that, but I think they well deserve it. That's all on those two.
Okay. Well, on the governor's National Disability Employment Awareness Month proclamation, the council in the copy, we will be sending out a media release. So we do have activities that we're participating in around that and planning a number of events with our partner organizations. So I don't know if that answers your question. We always do big activities around that, and Mike is heavily involved in that every year. Okay.
Okay, well, That's good. I thought maybe John would put out a press release for the awareness of the public that this is our annual thing that we do, mainly looking to the business people for the holidays to hire, similar to what we're doing up here, or I'm doing up here. That's all. I mean, I think it's a good thing.
Yep.
Yeah,
You know, that minimum wage has been a long time, you know. And like I said, I hear different numbers. I haven't gone too well, but you know, I hear a small number like 14, 15, maybe as high as 19 states only at this time. But there are others who are working on. Colorado, I worked with Colorado and Alaska. The last two that I was really interested in going day by day from legislation. Finally, Colorado passed it 2 years ago, and they're getting their 725. And the other one, other agencies are working, still getting the sub-minimum wage, $2 an hour, and maybe less or more. I don't know, but I'm just hearing both things, states what they're doing. Even in Arizona, we don't have it yet, but 18 or 19 states have it, and it's going to get at least we're in the improvement for wages. Because 725 isn't that much, because Arizona is getting, what, $14 an hour, and I heard yesterday on the news at Flagstaff in that city, they're getting they're going to be pushing $17 an hour for non-disabled people, of course, I'm thinking of. But mainly I'm looking at the minimum wage because they sure need it as well, I think. That's my last three comments, so I won't continue on because I know you got to close off the program today.
Sorry,
You're on mute, Melissa.
Thank you. Of course I am. I was just saying, I don't know if John or Mike or even Kristen might know status on sub-minimum wage in Arizona right now. Do you guys have any comments?
Yeah, I would just point to the comment that Mike just put in the chat that he will follow up with you, Mr. Delgado, regarding the sub-minimum wage and
yes.
Regarding a proclamation related to National Disability Employment Awareness Month. We have requested a proclamation from the governor's office. We have not yet been notified if she'll be issuing that, but we are following up today to find out where that stands. And there will be a press release going out from the various organizations involved in that effort. That includes ADDPC, the DD network as a whole, the state APC chapter, and others, and I suppose VR as well. There will be a press release going out related to the programs that are being hosted during October to celebrate National Disability Employment Awareness Month.
Thank you, John. And Mr. Delgado, Mike will reach out to you. Mike, thank you so much.
Yes, John, thank you very much for the information update. It informs me, and keep up the good job you're doing. You're doing it well. Thank you again, and thank you to the council for allowing me to make my remarks. Thank you again. Bye.
You're welcome. Thank you. Thank you for your participation, Mr. Delgado. Appreciate it always. Okay. If there are no more call to the public, if there are no more public members that have anything to add, I am going to adjourn this meeting. Okay.
Thank you.
Have a great weekend. Thank you.
Thank you. Good meeting.
John, can you hang on for just a minute?
Thank you.
I certainly can.
Bye, everybody. Thank you so much.
Thank you.
Thank
You're
you.
welcome. Thank you.
I guess we can
Stop recording.
stop recording.